Hi, my name's Kathy Hunter. I'm the Chief of Pediatric Surgery and the Fellowship Director for Pediatric Surgery. I joined the program about 2 years ago, and it's been my absolute pleasure. Oklahoma Children's Hospital is very unique in that we also provide care to both people from a very rural environment. Some of our patients drive as much as 4 hours to come and see us, but we also serve the urban area, so we have all of the typical pathologies and problems that you see in busy metro areas. We take care of about 75% of the pediatric population for our state, as well as caring for some of the patients that are in states on either side. That means that we really, I believe, have a significant and unique responsibility to our regional area that is different from some of the other centers that I worked in previously, where perhaps there were multiple centers within the same city even. So that is something that I find a challenge, but also something that really makes this very worthwhile. Oklahoma Children's Hospital is also a growing hospital. There's a lot of growth within all the different departments, and it's really an exciting time to be here in Oklahoma City. It's absolutely imperative to have the best possible care available to patients right here in the state that they live in. It is a shame when people actually have to travel outside of the state for care, and I can say with 100% confidence that we provide the best possible care for our patients here at Oklahoma Children's Hospital.
So you can see the Oklahoma Children's Hospital behind you. It is a 330-bed or so freestanding hospital that's associated with our adult hospital across the street, the University of Oklahoma Medical Center. One interesting fact about Children's is that on the 4th and 5th floor, all of our labor and delivery services are actually inside of our Children's Hospital. So our OB service is a fairly high-risk service, and so it's very nice to have all of the patients that we may have to be dealing with actually delivered in the Children's Hospital, very proximate to our neonatal ICUs.
I was a general surgery resident here. I took a short hiatus to finish my training in pediatric surgery, and ultimately came back because the environment here and the partners that I would have here are treating the state and the kids with the most cutting-edge care, and the collaboration here is wonderful. I think if you're a fellow looking at the program, specifically our program, know that you're going to have a significant amount of autonomy. All of the staff here really trust the fellows, and we do a very detailed job at vetting someone who's going to be the right fit for our program. And we look forward to training whoever we can get to better the future of pediatric surgery.
Compared to all the fellowships across the country, it has one of the highest number of cases performed over your 2 years in fellowship. So that was very appealing. Get a lot of reps, get a lot of practice, be very confident and competent coming out. And the faculty I got to meet on the interview day, and they just seemed like people that I would get along with, who were really interested in my learning, and that I wanted to spend 2 years with. As somebody who comes from the outside, Oklahoma City is an easy place to live. Cost of living is low, it's easy to get around, and my family likes it.
This fellowship is high volume, so we get a lot of index cases, we do a lot of cool stuff. One of the hardest things is figuring out which case you want to do, because there's so many good things happening at the same time. There's other programs that are a higher number of faculty to fellows, and so you have 15 faculty at some places and to the one fellow, so you don't get to know them as well, whereas we spend hours and hours with the same people, and so you develop a close bond with them as opposed to someone that you don't meet as often.
One of the things that impressed me the most as I've transitioned from the role of a fellow to the role of an attending is how well prepared I was by the training program here, because of the wide breadth of pathology that we see and the different patients we take care of. I feel very comfortable and confident in my role as an independent attending physician. We're a comprehensive children's hospital that includes labor and delivery. We're also the only level 1 children's hospital in the state of Oklahoma, so we see all the trauma patients. We're also the only hospital that provides pediatric oncology services such as chemotherapy and radiation.
We're very busy, but you'll walk away from this program and you'll be able to do anything you want to do.
At the clinics in Oklahoma Children's Hospital for pediatric surgery, we see a wide variety of diseases that affect babies and adolescents in Oklahoma, from rural areas to the city. We are the only full-service children's hospital in the state. We also see prenatal visits in which we get the opportunity to educate mothers with kids or that are expecting babies with a variety of congenital diseases.
I enjoy working with kids, and they're really fun to take care of. Oftentimes they don't even know they're sick, and so they're super tough and resilient. And it's also the trust that families put in us as pediatric surgeons to care for their children, at a pretty vulnerable point in their lives. The surgery fellows will operate, pretty much every day and do lots of cases, see lots of different types of disease. There's also a lot of autonomy with our program. The fellows run the service, they make plans, and get to operate a lot in the OR independently as well. So it's a great program for becoming a pediatric surgeon someday.